Florida, more than 5,500 students from one county are quarantining after being exposed to COVID-19. Schools just opened last week, and this comes after Florida's governor.
Hello, today I present to you an extremely attractive application for music lovers. It's completely free. You can listen to music online or download unlimited music to use whenever you don't have internet. The powerful search function helps you find anything you want. Trust me. It's hard not to find what you're looking for because the search function is really powerful. Application download link is attached in the description of the video. I'm pretty sure you'll like it. Thanks.
Governor banned mask mandates and threatened to withhold funding from any school defying his order. In response to the outbreak, the school board is holding an emergency meeting tomorrow to discuss requiring masks anyway. For more on the situation in Florida, I want to bring in Dr. Kartik Cherabuddi. He's an epidemiologist and an associate professor of infectious diseases at the University of Florida. So, doctor, in your medical opinion, with cases rising in Florida, thousands of students in one area quarantining, is a mask mandate necessary?
We have to use every protection we can. This is really the worst situation we've been in. It's tough. Our hospitals and EDs are full. I would endorse wearing masks at any place indoors that's not your home. I think we really have to move in that direction now. It can't be up to individuals.
Governor Ron DeSantis spoke yesterday at the opening of a monoclonal antibody clinic. Let's play some of his remarks.
There's going to be more throughout the state that we'll be rolling out, and each one of them we're looking at doing about 320 treatments a day. Now, hopefully you don't need that many, but what we want to send the message is if you do test positive and you're somebody, particularly if you're high risk for severe COVID outcomes, elderly folks, immunocompromised, morbid obesity, diabetes, kidney problems, chronic heart or lung conditions, this is something that really, if done early, can make a big difference.
So I think a lot of people want to know how this treatment works, if you think it's the way to go.
Monoclonal antibodies are essentially antibodies produced in a lab, if you will, at the right dose. They go into the body, administered at a certain dose, either through the IV line or given just under the skin. And then these antibodies go out and neutralize the virus in our body. If we think of it, the vaccine induces monoclonal antibodies produced by our own body. They're much more effective because the body knows when to draw them in and by how much to produce to fight off the infection. With the monoclonal antibodies, there are a few things I would say to remember. They're safe and effective. We've used them for months now in more than 100 patients. There's minimal or no cost to patients, but they're specific for each variant. The ones we used earlier no longer work for the Delta. The one we're using now still works for it, but we could lose it very, very quickly. Vaccines are clearly better in that they produce the antibodies quickly. They don't go away as easily with the variant. And importantly, the monoclonal antibody is resource intensive. It needs trained nurses. It takes about 2 hours of time, start to finish. And we don't have those resources. They're better employed in emergency rooms and hospitals and other places. Vaccines are much quicker, and we can administer thousands in a day compared to these monoclonal antibodies, which are more a tool that's in the reserve. If you have an immunosuppressed patient that got the second dose, maybe he's getting the third dose now, and still turns positive, that's where its real true value is using it in a select few patients.
All right, so what I'm hearing from you is that the monoclonal antibody treatment is no substitute for the vaccine, but it could potentially be used as a supplemental treatment.
I would say when you compare the percentages, if 95% is where vaccine is helpful, maybe 5% is going to be where monoclonal antibodies play a role. So let's not ignore the 95%. That's still the biggest deal.
Yeah, that's
Get
a
the
huge
vaccine.
Percentage. The Florida Department of Health also tweeted that these monoclonal antibody clinics will, quote, aim to proactively treat individuals newly diagnosed with COVID-19 in order to reduce hospitalizations. But don't you think encouraging vaccinations to prevent people from getting sick in the first place is a better method, that they should be tweeting about that? Or do you think it's a stopgap solution for people who refuse to get vaccinated?
No, I think it should be used in people who are vaccinated and then have a breakthrough in someone who is immunosuppressed and who can't mount an immune response, a transplant patient maybe.
Okay.
We have to use every tool we have, given the surge we have and how overwhelmed our hospitals are. So I won't say this is not important, and we continue to do it at UF in Gainesville as well. But the more important thing, like you pointed out, is by far the vaccination. I would agree.
What are you seeing right now on the ground in Florida regarding hospitals? How are the hospitals faring? Is there any overcrowding in ICUs?
Yeah, we've definitely not seen anything like this. This is clearly our worst surge since the start of the pandemic. We have more than 230 COVID patients in the hospital right now in UF Gainesville, and we are a referral hospital for many other hospitals. So it impacts not just the area we are in, but a much further area, because it impacts how many patients we can take in from these smaller hospitals. More than 100 people who are critically ill, more than 50 who are on ventilators, more than 12 to 15 kids who are hospitalized. These are crazy numbers, and there's a huge disconnect between what we are experiencing in the hospital, and 5 minutes later you step out and travel anywhere. It doesn't feel like we have this kind of an emergency. We are doing things as normal when things are seriously impacted in hospitals. The healthcare workers are on the verge of a burnout. If you don't take action immediately and seriously, I think we are in for a big problem.
All right. Well, thank you for that warning, and thank you for speaking with us today, Dr. Kartik Cherabuddi.
Thank you for having me. Thanks.
Hospitals are over